Our region's business is sponsored by PNC for the achiever in you. Our region's business, improving our economy, creating jobs, and strengthening communities. Innovation, collaboration, transformation, and the people making it happen. Join us as we take a closer look at our region's business. Now, here's your host, Bill Flanagan.
Today on Our Region's Business, from Equifax to Uber, crooks are out to steal your personal information. We'll find out what we can do about it. Plus, a young entrepreneur building a business on bow ties. But first, the ongoing revolution in healthcare in our region. No matter what happens with Obamacare and the individual mandate at the national level, billions of dollars are being invested right here in our region to pursue medical breakthroughs and improved clinical care. Last month, we focused on UPMC's plans to build 3 new specialty hospitals. Today, we're talking about what's in store for Highmark's Allegheny Health Network, which has unveiled a billion-dollar investment of its own. David Holmberg is back with us. He's president and CEO of Highmark Health. Good to have you back.
Thanks, Steve. I'm glad to be here.
Yeah, these are big plans. Very briefly, what are you investing in right now? What's part of the $1 billion?
Well, we're investing in the people of Western Pennsylvania. Put it as simply as that. So, 4 years ago, we were asked to build or stand up an alternative healthcare system, the healthcare system of the future. And what we mean by that is greater access, create more affordability. Most of healthcare, in America was built after 1946, when infections and accidents drove the demand for all these hospitals. The future of healthcare is about dealing with chronic disease. It's about providing care closer to where people live in a much more consumer-oriented experience. And so we're making significant investments. We announced, over $1 billion investment between the new cancer center that we're doing with Johns Hopkins at Allegheny General, and also a brand new hospital in the North Hills at our Wexford Health and Wellness Pavilion, as well as 4 neighborhood hospitals, which is really the future of medicine. It's about doing things closer to home, doing it more effectively, making it more affordable and a better experience.
And tell me about the neighborhood hospitals, because you're doing that in partnership with another organization called Ameris, right?
Absolutely. Ameris is our partner. This will be the first hospital system across the east of the Mississippi, to deploy this kind of capability. And it's all part of our strategy at Highmark Health to keep people healthier and to try to keep them out of the hospital. And to put it simply, these will be sites where we'll have primary care, and it'll be team-based primary care. So if somebody needs to see a primary care physician, not only can they see the physician, they can see a therapist, they could see a physical therapist, whatever they need. But also, it'll have specialists there. So if the community in that neighborhood needs somebody to do orthopedics, we'll have that capability. And then the third component, and the most important component, is it's 24-hour, 7-day-a-week emergency services. So it's a full emergency room, and in addition to the emergency room, there will be 10 to 15 overnight hospital beds available. Many of the people in this region, almost 20% of the people who end up being hospitalized, what they really need is observation, or maybe they need an infusion, or they need some level of care, but they don't need to necessarily leave their community and end up in a high-cost downtown setting. So what this does is creates a better experience for the community. It makes it more affordable for not only the patients but the employers, and it's designed for a different level of service. So when you walk into the emergency room, or if you come into the emergency room, all of the emergency room stations are designed, to get that patient in quickly, to get them seen quickly, and to be able to start treating them immediately, so that it should reduce some of the delays that people see today. So
you push the acute care and these short-term stays kind of out in the community. What then becomes the role of those big hospitals in the core in the city of Pittsburgh?
Well, part of the $1 billion investment, and actually Highmark and the Allegheny Health Network will have invested over $2.5 billion by the time we get to 2022 in total. And that was about building, the healthcare system of the future. So Allegheny General, we've made dramatic investments in our core strengths, which is the cardiac program, orthopedics, some of those things. At West Penn, we've really invested in the women's program, and in fact, we deliver more babies between West Penn and the community hospitals than anywhere. And and the whole idea and the reason why we added capability at Jefferson and Forbes from a labor and delivery standpoint was so that people could stay closer to home. But when somebody's really sick and they have a very acute event, we want to make sure they have best-of-class capability, and that's where an Allegheny General comes in, or some of our other sites.
West Penn with a burn center, really intense care where you need highly specialized people to do the
Absolutely,
work, right?
And we have a best-of-class team, and in fact, in the last 4 years, we've added an additional 500 physicians to our complement of capability. So what that does is gives you in the core city center, those really complex things, and we want to take care of people and make sure they have the capability. But wherever possible, we want to keep them closer to home. It's a better experience for the family. You get better outcomes, and you have the ability to to get them home sooner. And so that makes it more affordable, better consumer and patient experience, etc.
But all this building going on, I thought we already had surplus hospital beds here in our region. What does this do to that?
Well, first of all, the Highmark Health strategy, along with the Allegheny Health Network, is to keep people out of the hospital wherever we possibly can, and that's why we're doing so many new ambulatory sites. That's why we have 50 cancer sites around the region so that we can take care of people and not have them hospitalized. It's about having the right beds in the right places. I mean, it's not about the total quantity. So, for example, the investment we're making in the North Hills with the new hospital at the Wexford Health and Wellness Pavilion for the Allegheny Health Network, 215,000 people live in the North Hills, and we have the data that shows how many of them are being driven into the city somewhere to be taken care of. This is about giving them the capability they need in their community so that we can keep them at home.
Yeah, only a few seconds left, but all this part of the positioning to be ready for 2019 when that consent decree kind of expires and you and UPMC sort of go your separate ways?
Absolutely.
Yeah.
We were asked by the community to provide a different kind of health care system, one that was built for the future, and we've done that. We've seen over 200 and some thousand people who have switched their physicians and who have embraced what we're doing, and we're very excited about that and have embraced the Allegheny Health Network. So we think when we get to the middle of 2019, it'll be less of an issue because people are moving now.
All right. Well, exciting stuff all around us on all fronts right now when it comes to healthcare. David Holmberg from Highmark Health. Thanks so much.
Appreciate it, Bill.
Absolutely.
Good to see you.
Yeah. Next up, cracking down on the crooks online, the latest cybersecurity threats and what you can do about them. Stay with us.